It was not about health, unfortunately. And I'm like, oh my God, I've been doing medicine. I've been giving medicine for so long. And just touching makes this difference. We want to make sure that you are in charge of your health. You're not dependent on me, or you're not dependent on any doctor. I consider myself as a detective. I go back and look at what are all the footsteps that client would have taken to land up in this imbalance. So balance is the key, and this is how you're preventing and being intuitive and understanding what is happening, because your body gives you signals. This science has been protected for the past 5,000 years. It is our responsibility to protect it for many thousand years to come.
Welcome back to Freedom to Learn podcast. My name is Gurumurthy Yeleswarapu, founder and CEO of Silicon Valley for You. So this podcast is targeted for youth to make them understand different things that matters in real life. So on that note, today we have someone who brings very unique perspective to life skill, which is she's a doctor, and more importantly, she's Ayurvedic doctor. And for those who do or don't know enough about um, Ayurvedic medicine. So today is the time for us to learn from her. And so her name is Dr. Manju Kolli, and she's the Chief Ayurveda Officer at Ayurhitam. And also she's the President and Board Member of California Association of Ayurvedic Medicine. I've known her and her family for some time now. So welcome, Manju.
Thank you so much for that wonderful introduction, Guru. I wanted to correct a few things. I don't go by doctor. So it's a certified Ayurveda doctor. It's not an Ayurveda doctor degree. And so I don't go by doctor. So please call me Manju.
All right. Okay.
Thank you for
That's
that.
what I do. This is my first time I called doctor.
Yeah, absolutely.
All right. So let's for starters, right? So for all our listeners, just share your background, how it started in India, and what inspired you to pursue your career in Ayurvedic medicine.
Absolutely. I know I always call a backward journey, because I've done my pharmacy in India. I did my bachelor's in pharmacy. I did my master's in pharmaceutics after I came here to the United States. And then I pursued being a clinical pharmacist, actually. And I worked as a clinical pharmacist for 15 years. I worked in a long-term care facility where I was working for a lot of geriatric patients. And with these geriatric patients, it's necessary for us to understand there's many drugs. Each one of them have at least 15 drugs, blood thinner, reducing cholesterol, diabetes, protecting their heart, and many more medications that are there. Our duty was mainly to understand what the drug-drug interactions are, and to find out what medications are causing fall risks, etc. So doing that made me always feel like, whenever the labs increase, it always feels like we're just adding one more medication. We're adding one more medication. It never felt like we were looking at the root cause of what was happening. And when I took it to my boss, and my boss was like, this is corporate world. What else would you expect? I was also working as a supervisor at that time. I had 100 people working under me, where I had pharmacists, pharmacy technicians, and I had to look at, the productivity. I wanted to make sure, how many prescriptions are you getting out in an hour? How many patients are you seeing in an hour? All of this numbers game. It was not about health, unfortunately. So it was not fulfilling my soul. Of course, I was getting a fat paycheck at the end of the month, but it was not fulfilling my soul. And I ended up doing something called a Marma Chikitsa. I was a volunteer at Art of Living Foundation. Marma Chikitsa is something where you touch subtle parts of the body. And you just do a subtle touch with intention, and you open up the energy channels. And I saw profound changes in a lot of chronic conditions too. And that blew my mind. I'm like, oh my God, I've been doing medicine. I've been giving medicine for so long. And just touching makes this difference. And I wanted to know what the science was behind it. My inquisitive mind would not agree that just touching would change it. I don't want to just do things because someone said so. I want science behind everything. And that's when I studied, just a diploma course about Ayurveda, because the basis of Marma Chikitsa was Ayurveda. And I thought that I would just do it for my family because I was just always a health enthusiast and I was never taking any medicines. I would never give any medicines for my kids. I thought that I would just do a diploma, just understand what the food is like. And after studying 1 year, I was completely blown away. I was like, wow, there is some magic in this science. We learn all this, do ginger when you have cold, take turmeric. All of this was given as a household thing, but learning it formally was eye-opening for me. And I wanted to pursue it further. Then I approached a teacher who was doing a 5.5 year degree. And I told her, I want to dive deep. I want to do more. She said, if you want to dive deep, I would prefer that you quit your job and then do this full time, because it is not necessary for you to do full time if you don't want to switch your career. At that time, I said yes, because I just wanted to learn. I was just a nerd wanting to know more about Ayurveda. And I said, yes, I will quit my job, but I did not quit it. I was just doing part-time because I was there for many, many years. And then I studied for 5.5 years. And every time I learned something, I was blown away by the simplicity, yet how effective the science was. And
Yeah.
at the end of it, I started my journey of, because I studied, why not start a clinic? And I started my clinic 6 years ago in Fremont, and that's what I do right now. I've do my
Fantastic.
full-time practice as an Ayurvedic practitioner, and I don't do pharmacy anymore.
This is great. So did you say Marma Yoga? Is that what
Marma Chikitsa.
Marma
Correct.
Chikitsa? Okay.
Correct.
Man, I think a lot of people need Marma Chikitsa, in my opinion.
Of course,
Uh,
yes.
so yeah, I no, I wrote it down. I'm gonna talk to you later. In fact, I have a reason for talking to, not for me, for someone else.
Sure.
Um, so the now for those, right, from what you learned so far, from the Ayurvedic medicine. So by the way, I grew up, the priest that gave us place to live in the village I grew up. So in fact, so story is very small. When we moved to a very small village in Andhra, there is no such thing as a rental place.
Mm,
There is no tenant.
mm,
Everybody just lives there. It's small,
mm,
very small village.
mm,
28 students in school.
mm, mm,
So priest asked us to have place. He has extra ground and just live there. So that's
mm,
how we built our ashram.
mm, mm, mm,
And then I
mm.
lived
Wow.
there for 21 years, single room. So he's Ayurvedic doctor
Ah, okay.
also, and I mean, I obviously I grew up watching him every day. Patients coming in,
Mm-hmm.
doing he used to say certain things. I don't know what it was, but I grew up with Ayurvedic medicine without knowing what that is. But people used to say, right, patients come and they are very happy sometimes, and they go back, and there is no other medicine in my village. So back then. So anyway, um, for those coming out, right, the youth, from what you learn in terms of how to prevent
Mm-hmm.
certain lifestyle related conditions.
Mm-hmm.
So, is this, can you just maybe, I don't know if it's possible, but can you try summarize so that,
Sure. Sure.
they
Absolutely.
can potentially follow those?
Absolutely. And that's what about Ayurveda, right? Ayurveda is a manual of life. It is
Very
swasthasya
nice.
swasthya
Mm.
rakshanam. That's what the prevention is. That's the main motto of Ayurveda. We don't want many hospitals to be built, and that's the way that people were living in a village. The priest or the Ayurvedic doctor was always given a fee if they don't have to come to him, right? That's what they would give, like a dakshina every
Yeah.
month, so that their health is being protected. So prevention is always the first motto of Ayurveda. So what do we do, right? It is always The sun model, follow the sun, is what Ayurveda talks about. Brahme muhurte uttishthe is the first thing that is mentioned. A muhurta before sunrise is when you wake up. And when you wake up at that time, there is something called universe is always, waking up. You see the consciousness of the universe at that time, and you'll be able to perceive things at that time. And even physically, Vayu is much more at that time in your body, and bowel movements happen automatically. If you wake up later after 6 a.m., then Kapha comes up, which you see dew and you see mist in the universe. And that means there is Kapha. The movement part has reduced at that time. So bowel movement will not happen the way it is supposed to if you wake up later during the day. So that's no surprise that it was mentioned that you will have to wake up in the morning and then make sure that you do all the things possible to reduce the kapha aggravation in the body. I know I'm talking about terms of vata, kapha, and pitta also. I know, I don't know if a lot of us know about it, but understanding that removing the excessive mucus that is accumulated overnight, undigested food that has happened, has to go through with your bowel movements and make sure that you're doing jihva nirlekhana, which is tongue scraping, and making sure that after the kapha starts at 6 a.m. is when you start your exercise. That's when you're strong at that time, and you want to make sure that you exercise. And exercising was always done after you apply oil all over your body. If you see all of these, Mallayuddham or all of this Kalaripayattu, these people who are doing all of this were always applying oil all over your body before they exercise. So this is also mentioned in Ayurveda, where you apply warm oil all over your body. I typically apply warm oil and shower and then do exercise. That's typically how I do it, but it all depends on what is possible for everybody. But you exercise, making sure that you exercise only half your capacity. What is half your capacity? If you're huffing and puffing from your mouth, if you're sweating from your underarms, and if you're sweating from your forehead, then your capacity is done for the day. You would then want to slow down and continue the process next day. What is exercise? Ayasa janakam vyayamam. Anything that aggravates your heart rate. You're running, biking, jogging, hiking, jump roping, swimming, anything that you could do, along with weightlifting, is something that you would do. Then take very little breakfast. Breakfast is breaking your fast. It is not eating a lot of food in the morning, because that's again kapha kala. Now, between 10 a.m. to 2 p.m. is when sun is at its peak, and so is your digestive enzymes. Eating your biggest meal at that time is important. Then again, Vata Kala happens in the afternoon, where there's the afternoon slump that happens between 3 p.m. to 6 p.m. That time, sipping on herbal teas to make sure that you're awake and you're still able to do things. And then finishing your meal before sunset, before at least 7 p.m. to be practical, and going to bed by about 10 p.m. because 10 p.m. to 2 a.m. is again where moon energy is much high and you're able to release all the free radicals very easily. So if you are able to follow this in general, Guru, then it is possible for us to maintain health and prevent anything that is happening, because you're doing everything possible to balance your air element, to balance your heat element, and to balance your water element and earth element in the body. So balance is the key. And this is how you're preventing and being intuitive and understanding what is happening, because your body gives you signals. Your body gives you signals in terms of, either postnasal drip or congestion, or your eyes will not be able to see the way you're supposed to, or bad breath, or excessive salivation. So there's so many of these intuitive things that you look at, and you'll be able to, go back and do the balance for that. So that's like a concise answer for the question.
No, yeah, this is great. So the reason I always ask is, at least in my experience, there are no clinics where you can go for prevention of diseases.
Of
You
course
can
not.
go only for cure. Very strange.
Correct.
And sometimes I wonder, that's how business works, I guess. And back in the day, I mean, in my village, there used to be jokes around it. But even now, so that's the reason I was asking. So today, if would you, give some of these when people come to your clinic, to make sure that they don't fall into these, or okay,
Absolutely, Guru. And then I'll tell you, the motto for our clinic is, we want to make sure that you are in charge of your health. You're not dependent on me, or you're not dependent on any doctor.
yes,
And unfortunately, very, very, I mean, there is still 1% of my clientele that comes for prevention. 99% come to me only after everything else fails. Not even the first, that I'm not the first choice. Everything would fail, the MD doctor, Stanford. So there's so many other things that they would try.
yeah,
Only when they all fail is when they come to me, and they want quick fixes at that time. Unfortunately, that's how human mentality works. So
yeah,
when they come to me, it is necessary for me to go back and look at, I consider myself as a detective. I go back and look at what are all the footsteps that client would have taken to land up in this imbalance. And we would ask, of course, it's the diet that what make us and what break us. So I go back and look at the diet patterns that they have taken for their lifetime so far, what their lifestyle has been, and what their mental status is currently. When I put at all these, when I look at all of this, then we come up with a puzzle piece of what is the exact root cause behind this imbalance. When we do that, then undoing that root cause is the first step that we do. And along with it, I'd have to give some herbs or therapies to take care of the imbalance that the person is experiencing at that moment. Now, I get a lot of questions of, I did not follow the diet. I did not follow the diet, and so I did not take the herbs. People think that, if you have to take herbs, you have to follow this particular diet because herbs and diet interact. That's not true. It is the reason we tell you the particular diet is you're not adding any more toxins, or you're not adding any more imbalance to the body while you're given these kind of tools to remove the imbalance. You also want to make sure that you're not adding any more imbalance. So if you're not taking herbs, at least follow the diet, is what I typically say. So then I always call it a dynamic treatment. It is never a static treatment. When you go to a doctor and when you say, I have a cholesterol of 250, I have triglycerides of 150, then you know that you are given a statin. And this statin is given for a lifetime. It is never taken out. And that's like a standard thing. And you even know even before you go to the doctor. But the same thing comes to us as an Ayurvedic doctor. What we have to look at is we have to look at what is the reason for why this client has, ended up with the situation. And each one will have their own individualized approach. And once we give that, then we see them as a follow-up. It's mandatory. They come back to us as a follow-up because we need to see what has happened. We need to see how their tissues are, how the elimination is, how their mental status is at that point after they have taken the protocol. Then we change the protocol according to what we see. So this change happens until I know that they can sustain with the diet and lifestyle. That's when I tell them, I'm graduating you now. You don't need me anymore. And
yeah,
that is the goal at the end of it. And now we also have like these monthly sessions that we do from my clinic where I say, I want you to be still connected with the clinic. This is free of charge, what we do for all my existing clients, because once out of sight, out of mind, if you're not coming to the clinic anymore, then you forget that you're supposed to follow all of these. So we have these kind of programs where we handhold and we remind them what is important continuously. So yeah, prevention is very much part of our protocol.
yeah. Wow, this is, it's irony. So now this, irony is that, when you join schools, they say, oh, you have to take care of your health and everything, but one only thing that's available in the commercial world is hospital, which is just for cure, nothing else. And so this is a nice segue into the my next question. So we're all in the entire world is sort of structured around going to allopathy as your mainstream medicine.
Mm-hmm. Mm-hmm.
And a lot of people, probably some people don't even know we call it alternative medicines, right? Everything
Correct.
else.
Correct.
And so, so now, okay, which is fine. I mean, as long as um, this mainstream medicine is taking care of all your illnesses,
Mm-hmm.
fantastic, right? That's not the case.
Mm-hmm.
In
Mm-hmm.
fact, I am helping someone. In fact, I'm going to talk to you right after this call.
Mm-hmm.
Probably make an introduction, and this person is our client,
Mm-hmm.
and he has very rare condition. So he's trying to get a
Mm-hmm.
appointment at Stanford.
Mm-hmm.
Through my connections, I got, somehow I made that happen, but still didn't get the actual doctor to connect as of yesterday.
Mm-hmm.
So, but they're going there. Just it's a trial and error type thing. There is no guarantee. I hope everything works out great, but
Mm-hmm.
there's always fear, right? So, point is, um, like for somebody who's going through certain, like you said that, right? They try out everything before they come to you. This is like,
Mm-hmm.
so unfortunately, that's how we were all told ever since
Mm-hmm.
we were kids.
Mm-hmm.
And now my question to you is, how, can Ayurvedic medicine be the first line of defense for you? If there is a condition, can someone come to you first before they go to other ones?
Mm-hmm.
And can you talk more about it? Because at least for me, I don't have any awareness, in
Mm-hmm.
terms of, if you do this and then you can't go back to that, and yada,
Mm-hmm.
yada, if there are any boundaries like that,
Mm-hmm. Mm-hmm.
so
Absolutely.
that people come to know that, hey, maybe I can go to Ayurvedic doctor first, and then if it doesn't work, then I'll go to other one.
Absolutely. Yeah, sure. Definitely. We'll talk about that, Guru. So, as a part of being a president of the California Association of Ayurvedic Medicine, that's the goal, right? We want to make sure that we are regulating and licensing Ayurveda so that people know that Ayurveda exists for their own health needs. And the reason that most of the time people don't come to us is because insurances do not cover Ayurvedic services. And of course, if you're paying thousands of dollars for insurance every month, and you have to pay on top of what you have to pay, of course, human mentality, I would not want to go to Ayurveda unless I know what the science is behind it. So that's one thing that we're trying to do, where we want to license and regulate Ayurveda so that it's covered by insurances. Now, when can people choose Ayurveda as a first line of treatment? Absolutely, yes. Now, another problem here, though, is that Ayurveda and allopathy does not work together in the United States, which means allopathic doctor would not know what herbs we're using. They don't know what guruchi is. They don't know what ashwagandha is. They don't know how the pharmacology works inside once it goes inside the body. Thus, they wouldn't know what the interaction is between a guruchi and a lipitor if they're giving it together. So that's the biggest problem. There's no communication. And because of this lack of communication, the patient or the client will not know whether to choose this or whether to choose that, or is it a possibility to do both. Now, when they come to me, because of my knowledge of being a pharmacist in the past, I would know the pharmacology of how the medicine allopathic medicine works, and I would know the pharmacology of how an Ayurvedic medicine works. And I would never want them to stop their medicine if they are using it for a chronic condition, because your body is so much used to it. Your receptors are so much used to this medicine. So I would not ask them to stop their medicine, and I would add any Ayurvedic herbs or therapies or treatment. And once their condition reduces, once their condition comes back to a stable status, then their doctor will automatically say, it's okay, you can reduce this medicine now, or you can reduce this medicine now, right? So definitely it is possible for anyone to choose just Ayurveda. However, we're not able to do any diagnosis. We cannot write any lab tests, right? Because there's limitations as an Ayurvedic practitioner here in the United States. We cannot be writing any tests. We cannot be doing any lab tests. So if they're going through an autoimmune condition, let's say, if they're going to any of these conditions, it's necessary that they check their ESR or CRP and they check their lab levels to make sure that things are coming down. If they're going through any kind of inflammatory condition in the body, then it is necessary for them to know what's happening internally. If there is internal bleeding happening, checking with an ultrasound what's happening. If there's fibroid, if there's cyst, checking with an ultrasound. So with these diagnostics, it is necessary that we work with allopathic care in such a way that the patient knows that they are being taken care of. The treatment can be taken care of from Ayurveda, and then diagnosis can be done here to make sure that things are going in the right direction. And that's the way I ask my clients to approach. And I always tell them, do not be fearful. Do not, hide that you are going through an Ayurvedic doctor. I want you to tell your physician that you are working with an Ayurvedic practitioner, so that they know that some variability exists, and they will be able to, if they're open to it, they'll be able to do diagnostic tests, and you'll be getting the best of the both scenarios. And that's what I typically tell everybody.
Yeah, this is fantastic. As I said, I'm going to make an introduction right after this call, and so hopefully it will come out well. So, in the interest of time, so I have last question for the day. So, for the folks, the youth, right? Do you recommend them to take Ayurvedic medicine as a career path? And would you encourage them to do it? I don't know how many people are even considering doing it. Meaning, maybe they are. I don't know, at least. And if they do, if the answer is yes, how do they pursue that? Like, what are the avenues out there? Can you talk more about it?
I agree. And unfortunately, I don't have a straight answer for that. I would say that my nephew is very, very interested. And he's a fifth grader, and his teacher was asking everybody, what do you want to become? And he stood up and he was like, I want to become an Ayurvedic doctor. And the teacher was like, what? What is that? Right. So there are a lot of kids that come to my clinic. They are actually inspired, and they want to do Ayurveda as their career. And I would actually like it. However, we don't have any, we have schools in the state of California. We have 6 schools in the state of California.
Oh, great.
However, they're not regulated, right? And once you come out, it is a certificate that is given, but there is no board that is regulating Ayurveda in the state of California. Again, that's the mission that we have as an organization, that we're trying to improve the education standards in the United States, and we're also in the state of California, and we're also trying to regulate these. So there needs to be a credentialing body, and there needs to be a accreditation body. So we're working with Ayush also in India to make sure that the standards are all similar to BA, MS degree back home. And so that there are enthusiasts, a lot of enthusiasts. They come out as Ayurveda wellness practitioners, they come out as Ayurveda practitioners, and now there's an Ayurveda doctor program. They come out of it, but these are all certified programs, and they're not licensed programs. So that's the difference between them, right? Now the public is confused. They don't know the difference between a practitioner or a doctor or a certified wellness counselor or a coach. Whoever can talk well can attract more people. Nobody can understand the credentials. Everybody is practicing in the state of California under the Law of Health Freedom Act. So as an organization, we want to make sure that youth right now are able to choose Ayurveda as their career path. Now, Arya University in Milpitas is coming up with the Ayurveda program as well, called Sanam, where it's a naturopathy and Ayurveda program that's coming up, because naturopathy is now recognized in the United States, with Ayurveda as a, like a big chunk of it is going to be Ayurveda. So you'll have a naturopathic background, but you'll be practicing Ayurveda. So that's like a workaround for the situation that we have right now. But hopefully, when you ask me this question 2 to 3 years from today, I'll be able to say that, yes, Guru, we do have schools that are able to give out degrees, proper degrees that people can be able to practice Ayurveda. And I would highly, highly encourage youth to start doing this because this is necessary. This science has been protected for the past 5,000 years. And this is cognized by the universe. It is not something that's man created. It is not something that has been created by the intellect of human, but it is given to us as a manual, and this has been protected for the past 5,000 years. So it is our responsibility to protect it for many thousand years to come, because this is an emerging science. Even though it was written 5,000 years ago, it is still true to all the new emerging conditions that are coming up. Autoimmune was not a thing then. Inflammatory condition was not a thing then. Cancer was not a thing then. However, there are things, the principles that are written are still true and will be true. So I would highly encourage for youth to, right now, if they want to choose a medical background, integrate with Ayurveda is something that they can do. And there are 6 schools that are present in the state of California if they want to pursue that.
Fantastic. So hopefully in 2 to 3 years, I don't have to ask you. I just hear about them. It's out there. Everybody, just like they come to different universities, probably they see. And I am talking to Silicon Andhra for different reasons. And I know I'm aware of it. I speak to Devender, obviously Anand and everybody. So this is great, and hopefully it happens. But even I have soft corner for Ayurvedic medicine, as I said before. First, at least 10 years of my life, I used to see patients coming to Ayurvedic clinic, literally next door, and I used to sit right next to him when he was treating patients. Yes, and I know the smell of the Ayurvedic medicine. Let's put it that way. And also when he makes it, he when they make the medicine, there's some ritual they follow where they can't have people around them. Things of the I'm aware of some of those. They continued. His son continued for a very long time, even until 10 years ago or so. And now I guess there's nobody to. It's almost like a family thing. It's not.
Exactly.
Yeah.
Exactly. Exactly. That's typically how it is. It is more of a family. I mean, it is transferred from families. That's how it is typically.
Right. And then I think so. I think that the last person, he didn't transfer to his other 2 kids because one of them is in Canada, other guy is in Goa. That's the
Yeah.
end of it.
Yeah.
So
And it's not
just that
lucrative
part.
also, unfortunately.
Yeah, it
That's
didn't
why.
get transferred because I as a young kid, I used to ask. They said we are, apparently it's not for everybody. We are not going to transfer that to you and things like that. But anyway, I never had a chance. Thank you very much for being. It's very, very informative. We'll do another one sequel sometime later where we focus more on the medicine itself and some of
Absolutely.
the preventive measures as well as cures that are out there. The reason is that people must know the alternative approaches today. Anything in life in the world, if there is a monopoly and you have one thing, and if they say no, you're done. That shouldn't be the case. There should be some competition. There should be other ways to get yourself um, get benefited from whatever that may be. In this case, it
Correct.
happened to be medicine. So I think I am one of those proponents. I know we spoke before, we met other folks as well, but I'll be definitely in touch. And thank you very much.
Absolutely, my pleasure, Guru. And that's why we, as a part of, giving back to the community, that's how I got into social media, because I was never on social media. My Instagram, that's why I put every day something or the other of why you have to do, because it's not because my grandma told is why I'm doing Ayurveda. It's not because it's given to me 5,000 years ago is why I'm doing. Everybody needs to know the science behind it. So I try to, break down the science behind all the things that we do, all the rituals and all the principles that we do. Yeah.
Yeah. This is I hopefully bunch of folks who are watching this, they find some takeaways. they can research on their own. Hopefully they can reach out to you if they have questions, especially if they are in California Bay Area. Definitely, you can help them out in terms of if they have any interest in pursuing some of these. So with that,
Yeah.
I'll end for today, and
Yes.
we'll reconnect again very soon.
Yes. Thank you so much, Guru.